So as Adrian mentioned, I'm a pediatrician here in Colorado. I practice in Castle Rock. I'm board certified in general pediatrics. I'm on the adjunct faculty at the University of Colorado School of Medicine. And I've been practicing pediatric emergency medicine, hospital medicine, and primary care in Colorado for 20 years. And I was asked by the Momentum team to address the pediatric specific issues that we are seeing and experiencing as a community and nationwide as it pertains to the SARS-CoV outbreak and epidemic. And you know, the first thing I want to share is I think that most people in their interactions with the healthcare community are very used to doctors and healthcare professionals being pretty sure of themselves, being pretty sure they know what's going on, being very clear, very confident, and very self-assured in their knowledge base and their ability to respond. And I can tell you, as a practicing physician in this very, very interesting time, as well as a parent dealing with all of my kids being home and my wife being close to murdering them, is that it is extremely humbling and difficult to be in a situation where we don't have all the answers. The situation is very fluid. It's changing all the time. And every day we're trying to process, and sometimes multiple times a day, we're trying to process new information, new insights, information coming from around the globe, from places like Wuhan, China, and Italy and the UK, and helping and trying to apply it to our situation locally where we live. And the fact that the situation around the country is very different depending on where you live. So first, let's talk about the Kobe outbreak. I'm going to try to avoid a lot of the stuff that I'm sure everyone has been reading in the media and everyone has been already exposed to. But when it comes to the pediatric specific issues, is that we know very, very well that SARS-CoV mostly impacts from a dangerous level older adults and vulnerable patients. Vulnerable patients are people with chronic obstructive pulmonary disease, people who are 60 and older, people who have known immune deficiencies. We really don't or have not seen worldwide any significant serious illnesses in young children. That has been recently amended, though, by one study that came out of Wuhan, where they identified about 2,100 pediatric cases. Only about a third were definitively diagnosed using screening methods, but it was assumed based on a lot of other data that most of these kids had it. And there was only 1 or 2 cases of critical illness. And that does seem to hold water when we've compared that to our experience around the world, that the burden of illness on your children is extremely low, and your risk for your children's health remains extremely low relative to what we think it is in the older population. However, we do know, and there has been some, I think, questionable information that children somehow don't get it or they're somehow not susceptible. That is not true. Children can catch it. It's just that way more children seem to have either a mild illness or a completely asymptomatic, which means they're amazing at spreading it. So a lot of the measures and a lot of the things that you're being asked to do as it comes to social distancing, self-imposed isolation, closing down schools, shuttering businesses, has a lot to do with not wanting asymptomatic or mildly affected people to be the vectors to spread it to the highly vulnerable population, which are mostly our parents and grandparents. And you're going to find that as you talk to your pediatric providers and your healthcare professionals that deal with children, every day the process seems to be changing in terms of how we handle this. I'll give you an example in my office. Even yesterday, we were completely revamping our procedures. So I went out to people's cars yesterday to do sick visits in people's vehicles. Now, I'm 6'7", I'm pretty big. I was squeezing myself in and out of a Volkswagen Golf more than once. It was, really wish I would have filmed it actually. But that's the kind of thing that all of us are doing, that all of us are having to engage in, is constantly being willing and able to accept our own limitations, express a lot of humility, and be willing to change how we do things. So the medical and illness part aside, the other big, I think, burden that's unique to the pediatric population is really the anxiety component. I mean, First of all, you're dealing with a group of people, namely teenagers, who already have a very high prevalence of anxiety issues. You add what is being consumed on social media and mass media, not to mention this sort of spreading sense of dread that seems to be kind of going around the globe. And we're seeing way more issues with anxiety, even in kids who didn't really have anxiety before, but especially in kids who are having a lot of anxiety already. So let's talk about what can we do as parents and communities to, one, be responsible and do the right thing until we know more about preventing spread and protecting the vulnerable populations. But two, how do we handle our kids' mental health? So in the Milobsky household, we, like many others, have been forced into the roles of fourth grade math teacher and middle school science teacher, something I never really wanted to do. And that's uncomfortable, especially in a crowded house. So the first thing is, one, give yourselves a break. You're not going to be able to conduct your child's education at the same level. We are actually focusing more on what we call, life skills. I think that in lieu of necessarily making sure that our kids are getting every math problem, we're going to talk about more real world issues that our kids won't get in school. Maybe we'll work on negotiating the price of a car or doing your taxes, things like that. The one thing we're making very sure is that our kids are getting outside every day. You can still stay 6 feet away from everybody and make sure everyone's getting outside. You cannot overemphasize the mental health benefits to you and your children of natural sunlight, vigorous exercise, and getting out of your house in a responsible way. So exercise, making sure that everyone's diet is maintained. It's really easy when you're on a routine, but I know at our house it's a lot more challenging to maintain healthy eating habits, which also contributes to your mental health situation in this setting, and especially your healthy sleep habits. The most common questions that people have been giving me here in the practice and on my social media feeds have mostly revolved around the safety of their children. And I think we addressed that, about making sure that, or understanding that, yes, some small percentage of children can get sick. It is definitely not the norm. Most children and young adults are going to have zero or very mild symptoms, but they can be vectors for spread. I have a lot of people asking me about, am I personally afraid, and how long they see this lasting. Now, I'm not an infectious disease or epidemiologic specialist, but I can tell you from consuming most of the relevant information and literature on the matter from all the acknowledged experts in the field, is that the only pandemic experience we have in the last 100 years occurred in 1918. And in that setting, there was definitely a die-off in the symptoms, in the spread through summer, but then there was another surge in the fall. But the bottom line is that we can all expect that we're going to be dealing with this for a long time, maybe even longer than most people are expecting. Just, hey, my kids are out of school for 2 weeks or a month. We're going to be dealing with this for a lot longer. A lot of people are asking me about the idea of a vaccine. There are vaccine trials are underway. Israel has been on the front line of bringing this to the world, but realistically speaking, that's not going to be available to us for the better part of a year. But no, I'm not afraid. I feel still not necessarily being afraid, but still feeling a sense of responsibility and sense that action needs to be taken until the data and the evidence that's continuing to evolve tells us we should be doing something different. Finally, I think that the most, I think, important message that I learned from one of my rabbis that I have been trying to spread in my community here, in my practice community, and to my own children, is that we are all being asked to make very, very, very significant changes in our lifestyles and a lot of people's economic situations. I have many patients whose businesses are shuttered, who are not sure how they're going to pay bills, in our social functioning. And a lot of people are taking that and then functioning out of fear, panic, and self-preservation. I think that is why there's been the toilet paper run. But what one of my rabbis pointed out, which I think was a beautiful thought, is that yes, we still have to do the responsible thing. We still have to take appropriate action until we know more, but we should be communicating with our children, and we should be reminding ourselves that our mindset should be that this is because there is inherent value in human life, and that we are doing these things because we have a responsibility to humanity, our fellow man, and that our actions are going to perhaps save the lives and impact families who we don't know and will never meet. But when you approach, I think, the situation with that mindset, which with yourself and with your children, making sure your children understand that their actions are really because they're taking responsibility for someone else, I think it makes the entire situation, it changes the tone of what you're doing in your home. And it allows, I think, a much richer discussion on the value of human life, and that there's no such thing as a human life that is not worthy of everyone's attention and efforts in being saved. So I think that we had a lot of questions we want to get to. So ready to go to Q&A whenever the group wants.
Wonderful, wonderful. So the first question I have for you comes from a woman who says, my daughter and her husband have 3 children under the age of 4.5, the youngest being 3 months old, and their nanny commutes to their house daily. They don't know who their nanny comes in contact with when she leaves their house. How do you suggest they handle this situation?
Good question. I think that you really have to have a very, very specific discussion with the nanny, that we're all taking our responsibility in our actions with regards to social distancing and minimizing contact and spread as seriously as possible. And that if she is going to be caring for your children, that she is taking that responsibility seriously and herself maintaining the right amount of social distancing and minimizing contact. And if she herself is willing to do that, then the child care situation can be maintained. Also, she should be very, very clear and upfront if she's developing any symptoms of illness. I think that this is a good segue into the understanding that the main focus from a community standpoint in most places is, at this point, we don't have the resources to test every person who might have symptoms to try and understand every possible case. What the priority has become is the strategy of containment, which is people who are sick with symptoms that might be consistent with this virus, which, as we all know, are fever, cough, respiratory symptoms, aches, flu-like symptoms, that unless you're sick enough to require respiratory support and hospital care, it's very unlikely you're going to be able to find a test for yourself. And therefore, we should all behave in that situation as if there's a very strong possibility that you might be harboring the virus, and you have to take aggressive steps to isolate yourself. So, and I know this is all in the media, I don't have to go through all of them, but 6-foot distancing and minimizing social contact, if any, and aggressive hand washing and hygiene, all to minimize the spread. And if the nanny can commit to any of those things and you trust her as a person, then I think it's appropriate that you continue what you're doing unless she's unwilling or unable to meet that standard.
There's such a lot of trust involved in all of this when we're dealing with people outside of our general circle. I'm going to give you another question now, Dr. Michael. What about those of us who work in the medical field and more focused on those target populations of COVID patients, and how this relates to an immunocompromised 18-year-old and myself being pregnant? Are you concerned that going from car to car, you might pick up the virus and then pass it to people in the next car?
All right, so there's a lot in that question, but let's address first one. Pregnant women. We don't have a lot of data on the impact on pregnant women. My OB colleagues have briefed me on the CDC understanding of this up to now, as of yesterday, which is that there does not seem, at least in an obvious way, to be any increased risk of mortality or morbidity from this virus to healthy pregnant women. However, all of my OB colleagues said pregnant women are immune compromised in a very specific way, even if you are healthy. There is a known increase in morbidity or mortality amongst pregnant women with influenza, per se. So it is safe to assume that even though we don't have a lot of data or evidence on that, that a pregnant woman should themselves behave like someone who is an at-risk patient, which is at the best, as much as possible, minimizing contact and practicing self-isolation, self-quarantine, because we just don't know enough. And there's enough evidence comparing it to other things to suggest that it might be a problem. An immune-compromised 18-year-old would certainly be someone that you would treat like an at-risk patient. So once again, the advice that they're getting is aggressive self-quarantine, aggressive isolation procedures. And so any decrease in how much exposure to other people's environments you have is what you want to do. I know it seems hard. There's going to be tons of inconvenience here, but Italy is experiencing a situation where, well, now they don't have a choice and people are literally just holed up in their homes. We may want to think about coming a lot closer to that now so we can perhaps prevent something similar happening in our country.
Okay, I'm going to ask you another one. There are so many questions pouring in, Dr. Michael, you cannot imagine. If someone is infected with the virus and they get well, can they be reinfected, or is there an immunity that's been built?
This is another area where I think the medical community continues to be humbled by our lack of information on this topic. Based on some experiences in Wuhan, there are cases of reinfection. Remember, this is not just an alternate form of a common virus. You know, this is a completely novel virus that was jumped from animals to people. We have zero immunity as a species to this. So it's very possible, just from a basic medical understanding without having a lot of evidence to back it up, because we just don't, that we would be susceptible to reinfection. So even once you're cured, it's very advisable to continue the behaviors and routines around the distancing and isolation so we can not have multiple infections. But it stands to reason there are cases of people getting second infections.
Well, what if your child has asthma, someone else has asthma?
Sure. So that's kind of a confluence of two things. As we know, most children do not seem to get severe illness. However, asthma is a chronic obstructive lung problem. I wouldn't, once again, act out of fear. I would make sure your child's asthma is well controlled, and that's something you would be managing along with your primary care or asthma specialist. But you would definitely want to take similar aggressive precautions when it comes to that child. That child's school is probably already closed, so you're already doing that. The child should not be getting together with friends outside of the family. The child, you should not be going to people's homes. That's just in line with the way we're trying to advise everybody to act. But yes, it stands to reason that an asthmatic child would be, we think, at slightly higher risk for severe disease. There have been sporadic and small numbers of cases of severe disease in young children. We don't know whether those children had any significant underlying conditions like asthma or any other immune deficiency. It's just not available. Unfortunately, all that's coming out of China, which makes the information difficult to sometimes get.
Yeah, I bet it does. And there's so much vulnerability here. Okay, there's another question. Somebody is asking if she should keep her 4-month-old out of daycare. She was set to start on Monday.
Yeah, daycares I am putting those in the exact same category as school right now. They are very healthy vectors for rapid spread and distribution of the infection. So just like we're keeping our children away from each other at school, daycare should be put in that category. The 4-month-old really should not be going to daycare.
Okay, so then can you go to a public park with your child?
Absolutely. Now, I was talking very specifically, outdoor time, exercise are healthy. There's a lot of experts who are going to tell you, well, avoiding play structures and things where there's surfaces where your kid can touch. It's prudent, it's intelligent. I happen to also think that if you are spending time distant from people and your kid happens to run onto the jungle gym, a quick treatment with some disinfectant wipes on their hands would also be appropriate. But I think that children especially need to be out and need to be active.
Right. Okay, now should we keep our kids away from their grandparents? I mean, this is
absolutely your grandparents. Everyone's grandparents should be considered remote virtual contact only until we have more information about the rate and severity of what we're going to be experiencing across the country. everything we're talking about here, you guys, could be suspect to a lot of change in 24, 48, or 72 hours.
So
but yes, your grandparents should be FaceTime only for right now.
what about age of grandparents? Are we talking over 60 or are we just talking in general?
In general.
Really?
And because everyone 60 or over is really considered a much more high risk group. And so if we're serious about protecting our vulnerable members of our families and communities, then we have to take aggressive steps. And believe me, we're Jewish grandparents now. I know how the thought of Softy and Poppy not being able to hang out with your grandchildren just goes against every Jewish instinct that we have, but we really have to do that.
Except there is a deep Jewish idea about everything for the sake of saving a life, yes?
Absolutely, and that we are responsible to the whole and not just ourselves in small parts, that we have to take responsibility for everybody. That's how Jews think.
Yeah, I mean, this is a fundamental. I think all bets are off if it comes to saving a life. Okay, I have another question. I was hearing that you can have this virus before having symptoms.
Correct. And that's way more common in younger, healthy people.
Mhm.
In fact, if you look at a lot of these NBA players, I know everyone's reading the news.
Right.
These NBA players are having no symptoms, and a lot of them are testing positive. Not a lot. I think there's, going on 6 to a dozen at some point. But these are healthy, at peak condition 20-year-olds. They have no symptoms.
And someone else is asking, realistically, just your gut, we're not holding you to this, doctor.
Okay.
How long do you think the schools are going to be out?
It is going to be there's going to be an initial 2 to 4 weeks. I think my kids' colleges are shut for the YU has told my son not to expect to come back at all this semester.
And he was in the basketball that was winning.
Yes. Caleb Milobsky with the YU Max going to the Sweet 16. So listen, the silver lining here is that we can say, well, they would have won the whole thing easily. We can totally say that now.
Talk to me a little bit about social, like flattening the curve with social distance. Is that even an accurate term anymore, this flattening the curve?
So look, I think people, it's way easier to understand it when we talk about it in terms of just the medical system. Let's look at Italy. Italy has one of the most robust and well-developed health systems in the entire European Union. They went, in about a week to 10 days time, they went from having a few hundred cases in their country, sounds a lot like us, to a complete collapse of their healthcare system. Why did their healthcare system collapse? Because there was such a rapid surge in vulnerable patients who developed critical symptoms all at the same time. They did not have the resources to address every need and were forced to make horrible choices that no one wants to see made in our country, especially if it's our parents or grandparents. They are having to allow people who may otherwise have lived to die in parking lots and tents because there's not a ventilator available or an ICU bed available. That's what we mean by flattening the curve. Even if we still see the same number of overall cases, that perhaps we can prevent overwhelming saturation of our critical care system, so we can still address it without being overwhelmed.
Okay, now one more question. This one's a little bit frightening. How are you as a practice dealing with the pediatric, issues around newborns? What happens to the newborn and the mother after she's just given birth?
Okay, so first thing we have learned, and this comes from the same cohort of pregnant women, is that there does not seem to be what we call vertical transmission, meaning the mother cannot, through the birthing process, breastfeeding, or exposure to the in utero environment, those environments are not routes to pass along the virus. If the mother has the virus as a respiratory infection, she can pass it to the baby through close contact, just like anybody else. However, moms who may be ill or have symptoms can take care of their babies with the same precautions they take everywhere else, is wearing a mask, a lot of hand washing, but we don't have, there was one case well publicized, I saw it all over Yahoo, about a newborn in the UK that tested positive. I don't know if that baby got sick or not. We have, unfortunately, very little info on that. All we can say is that we don't think that it's passed directly through the birthing process to the baby. And that, remember, babies have circulating antibodies from their mother that lasts 4 to 6 months. That also offers what we call passive protection to lots of infections for the newborn.
I'm going to ask you one more thing. This is a little bit off the script, but I trust your wisdom. You're a Jewish doctor, the ultimate stereotype of someone caring for people and putting yourself, I might add, and I know everybody on this webinar wants to thank you for your continued care and selflessness.
Oh, thank you. Thank you. Listen, all of us who go into medicine, it doesn't matter whether you're a pediatrician or an obstetrician or an ER or critical care physician, we all took an oath. And part of that oath, and that oath is actually also represented directly in the Maimonides prayer for the physician, is that when you take this on as a profession, you are not able to opt out simply because things might become dangerous for you. And that if you look around this country, you see an entire population of Jewish, non-Jewish, Mormon physicians who are putting their own health and life behind the well-being of their communities and their patients. And that's what is expected of us as a community. I did get wind here in Colorado, because we've been getting phone calls from some parents. There are some pediatric practices here that have opted out of seeing sick children during this time because out of fear. I'm not going to say their name because I don't have absolute corroborated proof of this, but that is an abhorrent, unacceptable practice and goes against the very values that all of the physician community holds to when it comes to how we practice what we do.
Wow. Do you have time for just 1 or 2 more questions? There are so many here. I know there are sick people for you to see. But the next one I want to ask you is, if the symptoms vary, how can we tell the difference between the virus, a cold, allergies, and if we can't get tested, how do we treat within our own families? And if one person is sick and the others aren't, are we supposed to isolate that person within our own homes?
It's a great question. The short answer is you're going to be very hard pressed to be able to tell any of those apart. And
wait a minute, I thought there was no runny nose with coronavirus. That's why I'm like thrilled by my runny nose right now.
Listen, they're definitely, there are all kinds of little nice charts online about COVID, flu, cold, right. But the bottom line is that all of those are sort of average guesses. So if you have illness and flu-like symptoms, and because of the lack of availability of widespread community-based testing, which right now is just not a reality, unless you happen to play in the NBA, then you have to, and once again, I'm not talking about a little sniffle, but you feel fine. I mean, you're ill. You are having fever, cough, plus or minus body aches, and you feel sick.
Right.
That you should address aggressively, as there's a very, very decent chance that this could be COVID or some other virus, but it's my obligation to treat it and behave the same way, which is, number one, stay home. Do not go to emergency rooms. Do not call your physician, especially your pediatrician, but we are spending a lot more time on phone triage so we can help people manage their children's symptoms without coming in and exposing not just other people, but themselves to potential other things. So number one is stay home. Number two is contact somebody who you trust that will give you advice, and watch your symptoms. Within the family, yes, you have to do your best to isolate the person in the home from everyone else. Listen, I have now 8 people, some of them over 6, 7, all inhabiting a 2,500 square foot space. So I know that is not always possible, but you do your best. You wash hands all the time. You sanitize. You stay, 6 feet away if you can. When you're dealing with a young child, you don't have a choice. You have to take care of them, and do your best to take care of them while isolating them from the wider community.
Okay, so
the reason to seek care, though, but the reason is here. If your child, I'm going to just children because I'm a pediatric specialist. If your child is looking more ill, is unable to drink, and is having respiratory difficulty, then you take your child to an appropriate pediatric hospital facility where they will get appropriate care, and they can do SARS-CoV testing in most of those places.